Incidentally, only yesterday, I couldn't come here because there was a case very similar. That is the covering of the heart with a fluid between the two covering. So the child is, this one is a 10-year-old girl. This is just a coincidentally. It happened yesterday, and I canceled to come here. So that's what the child, that is 10-year-old girl, I operated yesterday. Of course, we have a limitation here because the instruments, we don't have the same instrument, all right? So you have to do with whatever is available. And we operated yesterday so that locally all the doctors here, plus all the medical students, they were there in the theater, so they are exposed to this type of operation. That's one. Second thing is because they see this type of operation, which is rare, maybe rare in this country, but is common in a lot of other countries, all right? Because every facility is available in those Western world, or even in my time, South African medical standard was very, very good. In fact, it was in par with UK and US. So when you are exposed, the local, so that they go and talk to the other people that in such a condition, there is a treatment here. Same thing, cancer of the breast. Now we get more and more people because they know at RVTS such a surgery is feasible and you can save their life. Today, after yesterday's operation, I went and saw this morning the 10-year-old girl. She says, I feel much better. All right, so this is what important. The girl could not walk. She was breathless. She was literally on oxygen. And this is what, it is nothing, not too much from our point of view, from medical point of view, but it's quite a new, something like people talk too much like a heart and thorax and this and that because it is not common here, not commonly done here. Normally, they send it to Dakar or somewhere else.
Doctor, I am a bit worried that the two patients you had were all youngsters, 10-year-old and the boy, I'm sure, not more than 12-year-old.
Oh yeah, the girl is 12 years old.
And the boy?
And the boy was actually about between 2 and 3.
How come children have this? I thought probably adults will have heart problems.
No, this is because a lot of people, there are a lot of different causes. One of the common cause for pericarditis, or what you call inflammation between the heart covering, commonest cause is TB1, tuberculosis, which is rampant in developing countries. One, in fact, now it is getting more common even in Europe and in America.
Okay.
So that is one of the causes. Second cause is people don't know what other etiology. But the main problem is if you know the cause or you don't know the cause, you are going to treat the symptoms. And as far as you are concerned, you have treated the child at your convenience, I mean in the sense best possible way. And they are running around, and you get a pleasure in doing that. It's nothing else, nothing like money or anything. Secondly, these children, you cannot send abroad. Every patient you see, you cannot send to Dakar or abroad because while waiting, they die actually. So this is what you can do the best, or you can do most what you can do. And this is because I had an experience. If I had not experience in those cases, I would have not done it, isn't it? This is a simple fact.
Doctor, let me take you to 1991. You were in Arizona and in the United States. You worked there.
Yeah.
Your practice in the United States from 1991.
Look, it is more or less same anywhere in the world. There is nothing like they are so sophisticated. The grass looks greener on the other side. Whatever operations you do here, you can do in America, England, and South Africa. All have got the same standard. It is not the country, I can tell you that. I'll give you an example later. It's the person. If you happen to get a good surgeon or a good physician, you will be called, not because that hospital. I give you an example. When I was in England, first test tube baby was actually called Dr. Steptoe, the surgeon. And I will not exaggerate, that was done at Oxford, Oldham Hospital. And those days, that particular hospital, in looks outside, was no better at all than RVTH. So it is not the hospital or the country, it is the people more, and that is why. Another good example, the patient who was Charnley, Professor Charnley, he invented this hip replacement. That hospital was smaller than your RVTH. So it's the people who make the hospital. Other good example, I was working with the elder brother of what you call it, first heart hospital was done at the GRTS hospital. When I was operating, I was in South Africa, I sent a couple of my house officer a recommendation. And they're working in GRTS, which is supposed to be the world known, people know that hospital because of its name. And people like to go and work. I always encourage some of the boys here. When I was here, I sent 2 Ghanaian boys, medical officers, who were working at Daming. They are working in South Africa. Because people go and learn at different countries, different procedure, and medicine, surgery, like any other branch, there is always a progressive. So you go and learn, like our boys, they go to Taiwan, all right? They may not be able to participate in surgical aspect, literally, because of our cultural differences, right? But even if they observe, right, they know surgery in a different environment. Same way they see people coming from US. They are impressed here because of our very limited resources, lot of instruments, a lot of, surrounding, but we do the same surgery what we do in any developed country.